and welcome to Wellness Watch, a show that explores the nuances and the burden of illnesses and diseases on mankind and how we in India are dealing with it. You must have most of the times taken deeper breaths after catching a bus or climbing a flight of stairs. But imagine this feeling of breathlessness never going away, no matter how much you try to catch your breath. This is what living with COPD can feel like. Chronic obstructive pulmonary disease, or COPD, is a group of lung diseases that makes it harder to breathe. In the beginning, it might seem just like a mild cough or a little wheezing, but over the time, a simple act of breathing can seem to be a struggle. Today in Wellness Watch, we discuss COPD and its management. I'm Preeti Kaur. Chronic obstructive pulmonary disease, or COPD, is a group of lung diseases that often develop silently over time. Marked each year on the third Wednesday of November, World COPD Day serves as a reminder of why greater awareness, early diagnosis and timely care are essential. We take a closer look at what COPD is, its symptoms and how it can be managed effectively. Here's a report by DD India's Harshita Oberoi.
COPD, chronic obstructive pulmonary disease, refers to a progressive group of lung diseases that make it difficult to breathe. It causes long-term blockage of airflow and reduces the lungs' capacity to move air effectively. Symptoms usually develop slowly. Breathlessness during routine activities, a persistent cough, and mucus production are the earliest signs. Over time, breathlessness increases and daily tasks become harder to manage. COPD includes two major forms. Chronic bronchitis brings continuous inflammation of the airways, causing long-lasting cough and sputum for months each year. Emphysema damages the tiny air sacs in the lungs, leading to severe shortness of breath, especially during physical effort. Long-term inhalation of cigarette smoke or polluted air triggers inflammation inside the airways. Sometimes genetics like alpha-1 antitrypsin deficiency trigger early COPD even in non-smokers. Over time, the swelling narrows the bronchial tubes and destroys the terminal air sacs, reducing the lungs' ability to move oxygen and carbon dioxide. The damage is permanent and continues to progress if exposure continues. Medical help is essential if cough and sputum persist for months. Breathlessness interferes with routine activities or infections become frequent. Early diagnosis can slow deterioration and prevent life-threatening respiratory failure. Smoking is the strongest risk factor for COPD. Increasing age, long-term exposure to irritants, and a history of repeated respiratory infections also raise the likelihood of developing the disease. Doctors confirm COPD through spirometry, chest scans, and blood tests. Spirometry reveals how much air the lungs can push out, crucial in detecting early obstruction. Treatment aims to ease symptoms and improve breathing. Bronchodilators open airways, inhaled steroids ease swelling, antibiotics fight infections, pulmonary rehabilitation rebuilds stamina, while oxygen therapy supports advanced cases. With the right treatment, many patients reclaim their routine and independence. Living with COPD requires a steady routine, staying active, breathing exercises, avoiding infections, and regular medical follow-ups. These steps help maintain lung capacity and quality of life. COPD can be prevented by staying away from smoking and limiting long-term exposure to substances that irritate the lungs. Staying indoors or wearing an N95 mask outdoors during high smog hours using air purifiers can significantly reduce risk. Because the simplest choices today can save every breath tomorrow. Harshita Oberoi's report for Wellness Watch, DD India.
So COPD is a progressive group of lung diseases characterized by restricted airflow and breathing problems. World Health Organization has projected a total of 2.28 billion cumulative COPD cases globally by 2025. It is the third leading cause of deaths globally, with household and ambient pollution and smoking as major contributing factors. Awareness is increasing with World COPD Day 2025 focusing on the theme Short of Breath, Think COPD, and it encourages early diagnosis and updated guidelines. Awareness is increasing, as we told you, with the World COPD Day focusing on Short of Breath, Think COPD. Today in Wellness Watch, we look for the following answers in the show. What is COPD? What are the triggers? What are the different stages of COPD, and can COPD be fatal? We also take a look at medical advancements in India. Alright, COPD treatment in India includes lifestyle modifications like quitting smoking and avoiding pollutants, pharmacological treatments such as bronchodilators and inhaled corticosteroids, and also pulmonary rehabilitation for exercise and education. For advanced stages, options include oxygen therapy, and in severe cases, surgery like lung volume reduction or lung transplantation may be advised. Also, basic and subsidized treatment is available through the National Health Mission. Up on your screens, we have some hospitals and institutes that particularly cater to this. All India Institute of Medical Sciences, Delhi; Rajiv Gandhi Institute of Chest Diseases, Bangalore; Guwahati Medical College, Assam; Government Hospital for Chest and Communicable Diseases, Visakhapatnam; and also Postgraduate Institute of Medical Education and Research, Chandigarh. To help us understand COPD better, we are joined in by guests. We are joined in by Dr. Randeep Guleria, President, AIIMS Bilaspur, and Chairman, Institute of Internal Medicine and Respiratory and Sleep Medicine, Medanta. He's joining us virtually. And we're also joined in by Dr. Karan Madan, Professor, Department of Pulmonary, Critical Care and Sleep Medicine, AIIMS, New Delhi. He's also joining us virtually. Thank you so much, both of you, for joining us this afternoon on Wellness Watch. Dr. Guleria, to begin with you, we've shown a detailed report to our viewers telling them what is COPD, but I would want you to explain to us in very simple terms, what is COPD and does it affect only the lungs? Sir, I would request you to unmute your device, please.
Now.
Yes, yes, sir. Please continue.
I think COPD is disease which is primarily a lung disease, which involves the airways of the lung, the tubes of the lung, which get swollen and narrowed. It also causes destruction of the parenchyma of the lung, which is also known as emphysema. So like you had mentioned in your presentation, it has two parts, bronchitis and emphysema, and it causes breathing difficulty, cough, whistling sound from the chest, and it's a progressive disorder, and if it's not treated in time, it can lead to respiratory failure. So it's a disease which involves mainly the lungs, but sometimes the inflammation or the swelling in the lungs can go on to other parts of the body, and it can lead to what we call systemic effects of COPD, like bones becoming weak, muscle wasting, and even cardiovascular problems.
Dr. Madan, what are the triggers when we talk of COPD? When is it the time to see a doctor? Is it evident only with a mild cough or wheezing in the beginning?
You need to see the setting where a patient presents. So COPD usually would happen in not a very young person. It would happen in someone who's, say, middle age, or, I would say more than 40 or 40 to 50, more than that. And usually there is a history of, as you mentioned, smoking is the strongest risk factor, or the setting of some irritant exposure. So if you have a setting in which somebody has a strong history of smoking exposure, it's not necessarily cigarette or BD smoke. It can also be biomass, smoke. Many of the females, they cook with biomass fuels and wood and other, sources. So if that kind of exposure has persisted and now the person complains of symptoms like getting breathless on walking, a cough which is not going away, there is cough and some sputum which is more in the morning. And these are kind of persistent problems. So this is the setting in which you would suspect COPD. So I think the context is very important, because asthma is something which is also very similar like COPD in symptoms. But asthma, many patients would have episodic symptoms go and come back. Then you have seasonal symptoms and you have younger people. So I think that is the setting you suspect COPD. And if you have any symptoms, you consult a doctor. Important to notice that sometimes, symptoms may not be, the only indicators. And, doing a spirometry or a test in which you blow out air into a machine, that is one thing which actually tells you whether you've developed some obstruction to airflow, which is, cardinal for diagnosing COPD.
All right, you're talking of asthma. Dr. Madan, can a person have both COPD and asthma at the same time?
So see, we actually, when trying to treat a patient or label a diagnosis, we try to label them with one clear diagnosis wherever possible, because usually the setting and getting a diagnosis label is, possible in most of the patients. However, there are some patients who say got symptoms which may show and kind of overlapping symptoms. You may have symptoms which have been like asthma symptoms, episodic symptoms, which were like seasonal, going on for many years from younger age, but now the symptoms have become kind of persistent, and patient is smoking also. So you may have a category of patients in which you term them as asthma COPD overlap, in which you think both the conditions may be coexisting. But I think for all practical purposes and wherever possible, one should try to differentiate asthma from COPD, because the management is also somewhat different between the two diseases.
All right, Dr. Guleria, how does lung damage progress in COPD, and is it reversible to any extent?
In COPD, there is lung damage as long as exposure is happening, and the disease, unlike asthma, is not totally reversible. So you can slow down the rate of progression of the disease. That if you take proper measures, avoid exposure to smoking, or ask this person to quit smoking, or exposure to biomass fuel, or improve the environmental factors, the decline or progression of COPD can be slowed down, but it's not a reversible disease. We say that asthma, once the allergen is not there and you give treatment, the person can become totally asymptomatic and it can reverse. COPD, the breathlessness and the cough will progress over time. That is why it's important to diagnose it early and be able to intervene to prevent further rapid decline of the disease. But by and large, it's a disease which will progress over time, and therefore it needs early diagnosis and aggressive treatment.
All right, it needs early diagnosis. Dr. Madan, what are the different stages of COPD?
So when we talk about stages, we kind of mean that how severe the lung damage has
Yes.
become. So what we do is, we look at a few things. We look at something like, symptoms of the patient. We look at whether somebody is getting exacerbations. Exacerbations mean that, you get episodes in which your cough and breathless really become too much. You might need to go to hospital. You might need antibiotics, steroids, and nebulization. And the third thing is that how bad your lung function test is on the spirometry test. That, as compared to a healthy person, how much reduced your lung capacity is. So when we knit all these things together, then we try to see, how severe it is. So say a patient who is getting exacerbations and going to hospital, say every month, or somebody who's got a very, very poor lung function on spirometry and symptoms are quite severe, that person gets breathless on very minimal activity. Those are the kind of patients who would term as one of the severest categories. And there may be a patient who just has minimal symptoms, maybe a mild category. So this is the way we kind of stage the disease.
Are only elders or people beyond 40 years, as you said, are only they prone to COPD? Dr. Madan?
Practically, for all purposes, yes. But younger people can, as you mentioned, in the setting of something like alpha-1 antitrypsin deficiency, or we may have a slightly younger age of onset in, say, biomass smoke-related COPD, in which the cooking exposure starts very early in life, and then those females, especially, could develop symptoms like COPD by the time they reach 35 to 40. So I think mostly you would have patients who are on the slightly higher age spectrum.
All right, Dr. Guleria, what are the symptoms of a COPD flare-up and how long does it last?
So classically, when you have COPD flare up, it can be because of an exposure or it can be because of an infection. So you would have worsening of the breathlessness. There could be accompanying fever. The cough could become much more. It could be with sputum production, which may be yellow in color and large in amount. And they could be also feeling that you're not able to get a breath in, your saturation is falling. And depending upon the severity of the exposure, the exacerbation can be mild, moderate, or very severe. Also, depending on the severity of the exposure and how aggressively it has been treated, it may take about 5 days to respond, and sometimes it can take a longer time. Patients who have mild exacerbation can be treated on an outpatient basis. You start them, you optimize their medication. They may need a short course of steroids, and sometimes, if there is an infective episode, they may need a course of antibiotics. But sometimes patients become more sick, their saturation falls, and even sometimes the carbon dioxide starts rising in the body. And then they need to be in the ICU where they're given what is known as a non invasive ventilation. And a few patients who become very sick may need ICU care in the form of ventilation. Therefore, I think the more important thing, as has already been mentioned, is to try and treat them so as that we can prevent recurrent exacerbations and diagnose an exacerbation early so that it can be aggressively treated and it doesn't progress to more respiratory failure.
Is COPD curable, or if I could put it the other way around, is COPD fatal? Dr.
So
Guleria?
COPD can be fatal. As the disease progresses. It can lead to respiratory failure. And as you mentioned, there are times when the patient is on long-term oxygen therapy. He may also need other treatment strategies if his lung function becomes very, very severe in terms of lung transplant. Therefore, I think the most important thing to remember is that by and large, COPD is a preventable disorder. If you are a smoker, you should give up smoking because you have a higher chance of developing COPD. We should encourage better use of good efficiency fuel rather than using biomass, wood, cow dung in kitchens which are not properly ventilated. Air quality should improve. So factors which lead to COPD, we need to see how we can correct them and thereby be able to prevent the occurrence of COPD. In that way, it is a preventable disease. But once it happens, then by treatment you can delay the progression, but it's not a totally curable disease.
All right, Dr. Madan, are any natural remedies, are they also helpful in curing or keeping COPD in control or minimizing it?
Any specific natural remedies, I cannot specifically comment, which is backed by strong data to, prevent COPD occurrence or progression. But I think general practices to, limit your exposures to, smoke and, fumes may be a suggestion which you could do. And I think if somebody has a very, very, COPD symptoms which are very persistent, and during change of season one gets, or during the high pollution days somebody gets pretty bad symptoms, then limiting your air pollution exposure, like you mentioned in the initial, video, that staying indoors during very high pollution days, limiting lot of outdoor activity during high pollution days, use of a particulate mask or a selective use of air purifiers may be considered to limit your exposure.
Added to this, what lifestyle changes can one make to minimize the risk of COPD, or for that matter, what advice would you give to people who are living in a very or highly polluted cities? What precautions can they take? Dr. Madan.
So I think we already have so much particulate exposure. The one and the most important thing is that avoid smoking. So I think smoking cessation is one of the very, very important advice which we need to propagate. That this is something which is totally preventable. And I think with the government's initiatives, the Ujjwala Yojana, the biomass exposure related COPD risk is expected to reduce. That if you are able to reduce the biomass exposure of the women, especially in rural areas when they cook, that is an important factor. The other thing is try to limit exposures to all the possible irritants one may experience even at say workplace. Somebody has exposure to noxious gases, fumes, paints, some things which worsen the respiratory symptoms. So by limiting the exposures, and this is one very important strategy, and avoiding smoking and all forms of smoke is important.
All right, Dr. Guleria, where is India standing on the global page when we talk of medical advancements in this field?
So India has made major advancements. One is trying to find the epidemiology of COPD, especially in the developing world, which is different from what we see in the West. For example, it's now a large body of data over, I would say, decades has shown that biomass fuel is an important factor, and that has led to various preventive measures in terms of coming up with what was initially smokeless chulas, better ventilation of kitchen, and the Ujjwala Yojana. There's also been a lot of data which has been collected at looking at other irritants which can aggravate pollution. A lot of indoor aggravants, indoor irritants which are associated with worsening of symptoms. It could be mosquito repellents, dhoop agarbatti. which can also cause problems. So these are data which is basically from India and India specific, or developing world or emerging market specific. There's also been a lot of research in trying to look at, is non-smoking COPD different from smoking COPD? Because like we're mentioning, smoking is one factor which causes COPD, but there are non-smoking COPDs. And we're also realizing that infections like tuberculosis can also lead to COPD in the later part in some people, and therefore there is a need to look at that. There's also research going on into what newer things can be done. Studies done at All India Institute of Medical Sciences even showed that in COPD patients, if we use yoga as a form of breathing exercises, it could help in better control of respiration and help in the managing COPD along with the medication that is given. So there's a lot of focus in the West on pulmonary rehabilitation, but studies have shown that even yogic exercises are as good as pulmonary rehabilitation if done properly, and patient acceptance in our country is much more as far as yoga is concerned. So a lot of newer things which are traditional in our own country are coming up in the forefront in terms of managing COPD in what is known as the non-pharmacological methods rather than just medication alone.
All right, so that was about COPD. We're joined in by guests who are explaining to us the severity of COPD, and we'll have a quick rapid fire round, myth buster round. I'll ask you some questions. I request both of you to give crisp answers. Dr. Guleria, first to you. COPD is a man's disease. Is it so?
No, that's not true. It's a disease which can occur in men and women both.
Dr. Madan, it is difficult to exercise if one has COPD.
Yeah, it is difficult to exercise.
Does that mean people with COPD should avoid exercise, Dr. Guleria?
No, people with COPD should exercise, but as we've been saying, in an environment which is good, but under controlled conditions, and they will feel breathlessness while exercising, but exercise will help in improving the lung capacity and increase the strength of respiratory muscles.
It is too late to quit smoking if you have COPD, Dr. Madan.
No, I think it's never too late to quit smoking, but because whenever you quit smoking, the risk of your respiratory, the symptoms progression and your heart disease risk also dramatically comes down. So smoking at any point of time is a very beneficial step.
Nothing can be done to treat COPD, Dr. Guleria.
No, that's not true. We have a lot of treatments available, both in terms of preventive strategy, which we've been discussing. New drugs are also coming up to manage COPD, especially in patients, in individuals who may have eosinophilia as far as the disease is concerned. And a lot of newer rehabilitative measures and newer treatment strategies are also there.
COPD is only prevalent in urban areas, Dr. Madan.
No, I think COPD is prevalent across urban and rural settings, and in fact, the non-smoking or a biomass smoke related COPD is especially more prevalent in the rural areas.
All right, with that, we end this discussion here. Thank you so much, both of you, for joining us on Wellness Watch this afternoon and helping us understand COPD better. So after that wholesome discussion, we now know how COPD slowly steals the breath, time and quality of life. It is not just a lung disease, it is a reminder that prevention is much stronger than cure. With awareness, timely diagnosis and lifestyle changes, we can turn a life of breathlessness into a journey of better breathing and better living. With that, we end this edition of Wellness Watch here. Till we meet next, take good care of yourselves. Bye-bye.